Now we're going to move on to, I think, the main treatment for Ciara, which is to improve the anterior cheek and the under eye itself. And I'm going to use two different products for this. I'm going to use a medium to soft G' product, which is Revanesse Ultra, to treat what's the so-called apex of the cheek. And then I'm going to move to Revanesse Revise to treat the tear trough directly. We'll talk about the products in a moment, but first of all, let's just find out where we want Ciara's most prominent apex of the cheek to live. And this is also known as something called the light reflex. So if you're having a photograph taken from you from the front, it's where does the light bounce off the cheeks? And if better to do this with you sat forwards again, if you don't mind. So where is the current light reflex? It's somewhere, I would say, around here. This is where I would say you're getting the maximum projection and bouncing of light. And anatomically, this isn't an anatomical structure. I'm not pointing towards the prominence of the cheekbone here. I'm trying to create a new prominence that's the most aesthetic for Ciara. And the way I like to find this is to find this orbital bone like this, and halfway across, I'm just going to draw my vertical line down. And this anatomically is the intersection between the medial and the lateral souph, which is a fat pad in the medial cheek. Along this line, I kind of see where I think we would like to have the most projection. And for me, somewhere around here, if I create a little bit of definition up here, for me, that is a beautiful feminine apex of the cheek. And in a male, you may want to make it more around here. Okay, that might be a more masculine apex. Whereas in females, it's usually lateral and superior. So the majority of my definition is going to go here, but I might have a more secondary area of general enhancement around it. And so those two concentric circles is where I'm going to focus my effort in creating this nice apex of the cheek, which will then continue to tail off with this cheekbone that's been created. So in order to treat that, I'm going to have to make an entry point underneath it, so around here. And then this same entry point is what I'm going to use to then directly target the under eye itself. So let's start off with the cheek. Sorry to interrupt this video. Hi, I'm Dr. Tristan Mehta, founder and CEO of Harley Academy, and I'm the one doing the injection that you're watching right now. I just want to take a moment to talk about our injectables diploma. So Harley Academy is a higher education college for aesthetic medicine based out of the centre of London, UK. And over 3,000 medical professionals have gone through our academic programs to achieve a postgraduate diploma in aesthetics. They will get a title after their name, PG Dip Aesthetics. If you want to learn more about our programs, how you can gain your qualification and learn how to inject in a really structured, systematic and evidence-based way, then click on the details below and our team will be happy to have a conversation with you. Right, that's enough from me. Let's get back to the video. But if you are enjoying this and you want to see more content like this, please subscribe and click like. So let's be moving in this direction. This will allow us to get both of those targets with a single entry point. And I've got Revanesse Ultra here. So the first thing to do is, this area is part of what's known as the mobile midface, and so we do need to be underneath layer 3. So you'll feel that I'm not even through the dermis yet, okay? So this isn't me pushing through layer 3. This is first getting through the dermis. Okay, now I'm through. Now I'm in the subcutaneous fat. I need to see this little dimple here. This dimple here is me then pushing through the orbicularis oculi muscle. It'll pop. There. Now I'm exactly where I want to be, which is in the middle of that circle, underneath layer 3, in the suborbicularis oculi fat. And here is where I'm going to focus the majority of my volume. So I'm going to fan with a cannula. That's about 0.2 mils, exactly where I want it to be. And then I'm going to use some additional volume in this second region just to connect everything up together. And honestly, that's all we had to do. We've got a very moldable product here. And so I'm going to just take the markings off, and then standing at the top of the set, just relax, yeah. I'm just going to use my finger now just to enhance the definition of the cheekbone here. But for me now, very happy with this new position of the cheek. Now let's take a look at Ciara again from the front. And here you can see this additionally higher cheekbones, beautiful projected feminine apex of the cheek, looking at it from this side and comparing it to this side. And you can see here this OG curve, which is the youthful shape that you see from a 45-degree angle looking at the cheek. And back into the center. Ciara, you can see yourself in that. Can you see it?
Yeah, massive difference.
Look good so far?
Yeah, really good.
Okay.
Like Matt said, it's made a big difference to the under eye
Yeah.
area. Yeah, really good.
So final thing now is we're going to treat the under eye. Now, if you give me a really big smile. So for injectors looking at this, it's not as easy as it looks. You've got this under eye roll here, which is hypertrophy of the orbicularis oculi muscle. And then we have this palpable bag as well. So there's two things that are making this an additionally complex treatment. And we have to be very, very careful and conservative when we're injecting. I'm going to use Revanesse Revise here as a extremely delicate hyaluronic acid gel with a especially low swell factor. And I'm going to be using the same entry points that I started with here. And for this one, I always ask the patient to look upwards as well. If you can just keep your eyes looking upwards, that gives me a better view of where I'm going. Okay, here we are. So I'm moving towards the under eye. I'm in the subcutaneous fat. And I'm going to have to move through the muscle again. So that's that dimple. If I just do it a little push, that's going to give way there. Now I'm in layer 4, and you can see the cannula under the eye. Turn towards me. And here's where we're going to be doing micro droplets with hyaluronic acid.
And because the skin is so thin in this area, and you haven't got much of any subcutaneous fat at all, you only need small volumes to get a good result. And we're always aiming to never fully correct, because we know that even with the product that's got very low swell factor like Revanesse Revise, you're still going to draw some water towards it. It's still hyaluronic acid at the end of the day. So correcting to maybe 75–80%, knowing that there will be a little bit of swell over the next week or two. We can always add more. Yeah, we can take it away, but it's much easier to add more a few weeks later than it is to dissolve things if you do get lots of swelling.
Now, it's tempting in this case to also do a tiny amount underneath the skin as well. Mm-hmm. By that I mean just subcutaneous rather than underneath muscle. And that's because I think Ciara's particularly low risk of edema, and because also to get this full correction of where we have this palpable bag, it's going to be more effective if we can do this. Now, Revanesse Revise has shown to be successful at not necessarily creating edema locally. So I'm going to do a very small volume just underneath the skin to try and improve as much as I can the under eye area. So this is staying now in the subcutaneous depth rather than underneath layer 3. And we can see the difference there. It's right underneath the skin. And I'm going to do the tiniest amount under the eye.
I've been doing this a lot. In fact, I'd say for most patients who've got good skin quality, I've been doing really, really tiny amounts subcutaneously. I'm not sure I'd feel brave enough to do it with any other product. And you'll see, even subcutaneously, you will feel that little bit of resistance, and often that's not because you're popping down through orbicularis oculi or the SMAS, but rather because, depending on where your entry point is, you'll sometimes be going through either the zygomaticocutaneous ligament or the orbicularis retaining ligament. So it's not always that you're going deep; you may just be going through ligaments.
Perfect. All right, so on a scale of 1 to 10, how was that pain-wise?
Yeah, probably about 5.
Okay, we got a 5 there.
Yeah, not too bad though.
Not too bad, okay. And eyes up for me. I'm going to give it one very gentle little massage under the skin. And now let's take a look at final under eye results. Okay, so I hope you can appreciate here an improvement to the cheekbones, also the eyebrows, and also an improvement along the jawline. If you notice here, this jawline here is a little higher up compared to this side as well. So all of this has started to lift laterally. Then create this lovely new cheek apex and then continue the treatment under the eye. I'm not going to do any more under the eye than this. And you'll notice there's still a very subtle shadow under the eye, but a significant improvement compared to the other side. And I think this is often where injectors go wrong and they want to chase that shadow and try and completely eliminate it. I'm fairly sure Ciara will be very happy with the reduction. If you use a really big smile as well and relax. Any additional volume in this area, given the complex factors of the palpable bag plus the hypertrophy of the muscle under the eyelid, would make this too complex for a stage 1 treatment where we add any more volume. We can always add more at a later stage. But I'm just going to show Ciara in the mirror and then you'll get to see it. Outside of that, look, go on.
It was good, but didn't hurt much.
That's it.
Great.
All right.
Okay, so tell us, what do you see?
Yeah, like for me, it's like how contoured my cheek is, and under eye just seems so much brighter. And it doesn't dip in as much at the bottom there. Yeah.
Happy with that?
Really happy.
Natural?
Yeah, really, really happy. Yeah,
Okay.
really good.
What I'm going to do is I'm going to do the other side now off camera and then I'll show you the full results in the mirror. Okay, so we're back now having treated both sides of Ciara's face. Let's just summarize the treatment plan here. So we did the temples here to try and create some lift to the tail of the brow and to create some lateral tension. And then the cheekbones themselves have had this additional really nice definition to try and continue this beautiful apex of the cheek all the way backwards and lift the height of that lateral aspect of the zygomatic arch. There's been some volume in this area to try and just create a little bit more definition along the jawline as well. And then finally, the treatment in the anterior cheek and under the eye to soften the depth of the shadows under the eyes. So I'm really happy with this treatment, and we're now going to move on to the Toxin treatment in the forehead and the masseter muscles. But before I do that, do we have a mirror for Ciara, please? How did you find the treatment?
Yeah, a lot. Like, it was not painful at all in the grand scheme of things. No, I'm really happy. Yeah, I mean, my under eyes so much brighter.
Is that the biggest difference you notice?
And no, my cheeks are amazing. My cheeks are really, really contoured. But I'm really just impressed with everything. It's brilliant.
Okay, amazing.
Thank you.
Thank you very much. So let's move on to the Toxin treatment next. Okay, final treatment for Ciara today is just Toxin to the upper face. It's been 4 months since she's had her Toxin treatment. Give me a really big frown. Okay, so you can see the glabella movement there. It's very subtle, okay? We don't have serious dynamic muscle activity. Then raise as high as you can. We have some forehead lines. I've done my usual points for treating the forehead, but I'm only going to use 2 units per point to create quite a soft effect. And I've done 2 additional higher injections up here, which will actually contribute to heightening the hairline as well, which I think will be really nice with this kind of beautiful smooth forehead. And then really big squints, very little movement around the eyes, but enough to justify just a single injection on each side. So I'm going to show you my injection for Toxin. This isn't a particularly in-depth Toxin tutorial because, well, we'll do that another day. But I'm just going to do this for the purpose of showing you what Botox looks like before and after when Ciara comes back. These injections are deep to treat the medial corrugators. And then these injections are just intradermal to treat the tail of the corrugators with 2 units to create this little blanching effect in the skin. Then we move on to the forehead here, and we're just doing 2 units per point, creating these subdermal blebs. If this looks like it's fast, it's because when you do your first Botox treatment, it might take you half an hour, but once you've done enough of these, it does definitely become second nature.
How many do you reckon you've done, Tristan?
I don't know. I don't know. I've definitely treated thousands of patients. I'm not sure how many particular Botox injections. Final one around the eyes. Going to do 4 units per point. All right, so let's clean you up. And then how many more weeks is it until we're going to see you back in clinic, Ciara?
Is it 2?
Is it 2 weeks?
No, I don't know.
Oh, I mean for your follow-up.
Oh, whenever.
Okay.
When would work?
After the wedding or before the wedding?
Well, I can let you know if I've got any issues, but otherwise maybe after the wedding.
Okay. Great. Well, thank you so much, Ciara.
Thank you.
Great case study. We'll see you next time in clinic.
Thank you so much.
All right.
What we learnt in aesthetic medicine even 1 or 2 years ago is now outdated. Why? Because aesthetics is still a relatively new science, and the research underpinning our work, particularly our understanding of anatomy, has advanced significantly. Hello, I'm Dr. Tristan Mehta, founder and CEO of Harley Academy, and I want to introduce you to GEM, the Global Evidence Matrix. GEM is a dynamic, evidence-based framework that gives injectors a clear, consistent guide for safe, effective treatments, all grounded in science, not in corporate sales pitches. GEM combines clinical research, anatomical knowledge, and injector expertise, and it's always updated with the latest evidence. Think of GEM as your interactive map for facial aesthetics, guiding you through every step from technique to product choice. With GEM, you're not just injecting, you're working at the forefront of medical aesthetics. Join us in setting a new standard for safety and results.
Welcome back to clinic at Harley Academy. My name's Dr. Tristan Mehta, and I'm here with Ciara from our treatment a few weeks ago. So welcome back, Ciara.
Thanks.
How's it been?
Yeah, really good. Settled really, really well.
So let's talk through the treatments we did, and then I really want to get your honest feedback, and for people watching, maybe tell them a bit about the recovery process.
Yeah.
And then I want to know how you're feeling about the big day.
Yeah, of course. So we treated my temples. That was the first treatment, wasn't it? And then we went down to my cheeks, and we did some shaping and sculpting around my cheeks, and then we treated the under eye.
The under eye was one of the main concerns for you.
Yeah.
Feeling a little bit hollow here.
Yeah.
We wanted to create some shape for the cheeks.
Yeah.
We also did your Botox.
Yeah.
As well.
My forehead, yeah.
So a really classical treatment for someone in their early 30s for looking for a bit of beautification, especially if they've got a particular area that they're concerned about. In this case, it was the under eyes.
Yeah.
So for me, immediate impressions is I'm really, really happy with how everything's settled. I think you can see here really beautiful, natural result for Ciara. If I take us through it all systematically, let's start in the upper face. So big frown for me. Okay, so this is what Botox looks like 3 or 4 weeks after treatment. Very strong effect to here, and then raise up as high as you can. We don't have any, we don't have a frozen appearance. If you raise as high as you can, you've still got some movement of the brows, and relax. Show everyone that you can move your eyebrows still. Yeah, okay, good. And big smile. So natural appearance, okay. Exactly what we want from a the dosages that I expected, which is a slightly lower dose in the forehead. And then we move through to the mid-face, and I see this beautiful projection at the front of the cheek, and then we have this nice tail of the cheekbone, the zygomatic arch, and you can feel the gel under the skin. So for someone who hasn't had filler before, how does it feel to have this under the skin?
Yeah, it's a funny sensation. I'd say that it does feel like I've almost got a line. It's obviously not really obvious, like a real solid line, but it does feel like I've got more of a contoured line here that just shapes the cheek. I would say it feels harder, a harder consistency. But no, I would say other than that, it's not something that kind of I'm really aware of.
Great. Under eyes as well. I think we've really managed to soften this. If you put your chin down and eyes forwards and look at the camera with your eyes. Yeah, that is the shot. If someone has deep under eyes, that will really show it. And after treatment, you can see we still have a little bit of a shadow, but it's a very natural effect. Did you get any puffiness under the eyes?
No, not at all.
Okay, fantastic. And what stands out the most to you after treatment?
Probably the bruising. I was I would say quite bruised, but actually in the grand scheme of things it wasn't, and it went very quickly. I've got a slight bit of bruising still, but nothing major. It was probably more bruised one side, but I think that's when I bled a little bit. Other than that, it was very smooth sailing. I had no issues at all. I wouldn't say that it was very obvious to anyone that I saw in the week after that I'd had treatment.
Okay. Did anyone say anything, friends, family?
Just that I looked really healthy, that I just looked like I'd had a really good night's sleep, that I obviously had quite a contoured appearance, which I was very chuffed with. And my under eye area, everyone said, just looked really bright.
Yeah, amazing. What's your favourite part of the treatment, would you say?
Do you know, I just love my cheeks. I really love my cheeks, but it is, for me, it's the under eye area where I said to you the beginning stages before we did the treatment that I felt that I was continuously putting concealer on and it just wasn't actually impacting my under eye at all, and I just felt really insecure about how deep and sunken my under eye area looked. So for me to now feel like I put a tiny bit of concealer on and it immediately goes away, it's really changed things for me, definitely.
Okay, love to hear that. And if you remember, Ciara is getting married in
a month today.
And so this is why we say, really, I wouldn't treat Ciara today if she said, I'm looking for this treatment. And think about it, it's been maybe 4 weeks and there's still, I think, a very faint bruise here, okay? So there's things that we wouldn't want to take any risks for see that little gentle bruise here? We don't want to take anything for granted, and things can happen. Ciara's ended up with a really nice result, but the minimum amount of time is 6 weeks for me, ideally 8 weeks. And so you're now confident 4 weeks away from your wedding, that you've got no problems, it's going to be all good. The Botox can settle in a bit more. So that's the kind of distance I'd give it. So you excited?
Yeah, no, I think it's definitely nervous. Yeah, I think it's starting to feel very real now. I feel like I've got my second Profilo today, which is like the kind of last injectable appointment now. So I feel like all of kind of my beautifying appointments are done, and I'm feeling really good about just the way my skin is, and obviously like having that kind of blank canvas before I have like my bridal makeup on. So I'm feeling excited. For me, a couple of years ago, I was quite against filler. I think, like a lot of people, I felt very scared around the risks of it and thinking that you only had one result from filler, which was that kind of botched appearance or it migrating or the kind of complications that come with it, albeit rare. But actually having that kind of treatment where it's so subtle, it's so gradual, and you still look like you, but actually it's just enhanced the things that you liked about yourself, but also helped with the things you didn't like about yourself. So naturally, so gradually, it's really, really changed how I feel about myself. I was feeling very insecure, and it's just such small changes that made such a massive impact. So if you're considering it, obviously making sure you go with the right practitioner, someone you really, really trust, it can have a lovely, lovely impact.
Perfect. Well, thank you for that. If you want to see more content like this, we're doing a case study every month on our Harley Academy channel, showcasing our techniques. But for now, join me in wishing Ciara a fantastic wedding, and congratulations.
Thank you.
And hopefully we'll see you again soon.
Yeah, thank you.
All right, thank you.